Good evening, and welcome to our virtual Black History program on behalf of the Black History Committee of the Johnston County Heritage Commission. My name is Pearl Blackman. We are pleased and proud to honor and gratefully acknowledge African American healthcare professionals in Johnston County. We, the Black History Committee, extend our special thanks to Dr. Pearson, Mrs. Lucille Rayford Jones and her family for their participation. And we thank you, our audience, who have taken the time to join us in celebrating these professionals who enhance the lives of others daily and have been supremely resilient through all care due to coronavirus and the resurgence. We also thank the health professionals and others whom willingly assisted us in accumulating the information we have acquired. At this time, Todd Johnston, Heritage Center Director, will give a historical perspective of African American health care.
It is a privilege to recognize the contributions of individuals in our county who have been on the front lines of providing medical care to our citizens. Before we name our current practitioners, I would like for us to spend a few minutes reflecting on the contributions of those whose shoulders they stand on. Enslaved Africans, Native Americans, and Europeans all used roots and herbs to treat the sick. This was by necessity because there were very few doctors. Even when professional physicians increased in number in the late 19th century, herbal medicine and home remedies were so ingrained in the culture that calling a doctor was always a last resort. In the first few decades after emancipation of slaves in 1865, medical reports show that there was a marked increase in the number of cases of tuberculosis, also called consumption, and a higher rate of disease and death in general among African Americans. Since freedmen did not receive the 40 acres and a mule that they had been promised, most were forced into an oppressive sharecropping system in which landlords and merchants demanded that they invest their time and energy in cash crops. Some poor whites also fell into this trap. Food crops were neglected, and diets and health suffered as many people subsisted on fatback, molasses, and cornbread. They drank water from open wells that could easily be contaminated by birds and insects. As racial segregation became institutionalized, it was uncommon for white doctors to go into black homes. To fill the need for black doctors, missionary organizations built universities for freedmen and started medical schools, such as Leonard Medical School at Shaw University in Raleigh. At first, the faculty was all white. Well-trained black doctors graduated only to find themselves barred from membership in the American Medical Association and state and local societies simply because of the color of their skin. Black doctors formed their own societies while still seeking medical advice from and giving advice to their white counterparts, who greatly outnumbered them. Over 400 black physicians were trained at Leonard between 1881 and 1919 when the school was closed. There were 2 Johnston County natives who received medical degrees there around the turn of the century, but both chose to practice elsewhere, one in Wilson, nearby, and another in Edenton, North Carolina. It was not until 1912 that Johnston County had its first credentialed African American physician, but he stayed only a short time before returning to Raleigh. In 1916, a young physician from the British West Indies had just graduated from Leonard and had heard about the shortage of black doctors in eastern North Carolina. He was headed to Dunn in hopes of hanging his shingle there. An ice storm delayed him at the train station in Selma, and a Mr. Wall convinced him to stay there. Mr. Wall even allowed him to use an upstairs room in his home as his office for about a year. The young doctor then moved to Smithfield, opened an office in a black-owned commercial building at the corner of 3rd and Market Streets, right across from the Heritage Center, beside the library. Until the 1960s, he would be the only African-American physician in this county. His name was Charles W. Furlong. Dr. Furlong's mother was a healer in Antigua and Trinidad, and it was her work with herbal remedies that inspired him to go into medicine. A few years after Dr. Furlong arrived in Smithfield, a small hospital for whites was opened in 1920. Then a privately owned county hospital was built in 1926. It had a colored ward, which included 3 rooms accessible through a back entrance. It was separate, but certainly not equal, and Dr. Furlong did not have privileges to treat patients there. It was no coincidence that 3 years later, he built his own small hospital across town. It had 12 beds, later 15, an operating room, living quarters for nurses, dining and kitchen facilities, and an office. Local black teachers and students and black church groups in Smithfield, Benson, and Dunn raised money to help with the furnishings. Dr. Furlong performed routine procedures in his OR. He trained midwives and delivered countless babies in his hospital and in private homes. He gave physical examinations and vaccinations to school children. For serious illnesses, he would send patients to hospitals in Raleigh and Durham. And in those days, before they had ambulance services, a lot of times the doctors would have to drive the patients to these hospitals in their own personal vehicles. He eventually had a wife and 2 children and built an attractive Tudor-style home on South 5th Street here in Smithfield. He's remembered as an avid tennis player and built his own tennis court. He was also a lover of wrestling matches and new Buick automobiles. More importantly, he was a mentor and a counselor to generations of young African Americans, many of whom pursued careers in healthcare. There were at least 2 young ladies from Johnston County who became registered nurses in the 1920s. Annie Smith Fields of Smithfield and Iola Grandy of Wilson's Mills, both trained at St. Agnes Hospital in Raleigh. Miss Grandy became the head nurse at Providence Hospital in Danville, Virginia. Following World War II, an effort mounted for a modern hospital in Johnston County. In 1951, Johnston Memorial opened with facilities and services for African Americans that were touted as separate but equal. The second floor was for black patients and was staffed with black nurses, including one lady we are honoring very shortly. There were separate waiting rooms, restrooms, labor and delivery rooms, newborn nurseries, and dining rooms. Black nurses could not dine in the cafeteria, so they took meals in the small lounge where the orderlies and the housekeepers ate. The operating room was the only space not segregated by race. The blood bank was segregated only by blood type and not by race of the donor. Dr. Furlong was given hospital privileges at JMH, so he eventually closed his hospital across town. Over the last 50 years, a growing number of African Americans from our county have joined the healthcare profession, some of them finding opportunities in other locales. We've been fortunate to have a number of highly qualified individuals from other places to choose to work in Johnston County. I will now yield the podium to Denise Joyner Bennett, who will introduce one of these medical professionals who is our keynote speaker.
It's my pleasure to present our speaker, Dr. Marilyn R. Pearson. She is the Public Health Director for Johnston County. Dr. Pearson received her Bachelor of Science degree from Clemson University and her MD from the University of North Carolina at Chapel Hill. She completed her internship and residency in family medicine at Carolina's Medical Center in Charlotte. After 7 years as a physician in the Johnston County Health Department clinics, Dr. Pearson became Health Director and Medical Director. In this capacity, she directly supervises physicians, physician extenders, and other managerial support teams. She also oversees services provided in the preventive health, environmental health, and behavioral health divisions. Dr. Pearson serves on many county and state boards and committees and also serves as Congressional District 7 representative for the North Carolina Medicaid Medical Care Advisory Committee. In January of 2015, she was named North Carolina Health Director of the Year. Dr. Pearson has been married for 24 years. Her husband, James McLean is a retired medicinal chemist. She is also the mother of 2 children, Jaden and James. Dr. Pearson enjoys reading, sports, and serving in multiple capacities on youth extracurricular teams and clubs. We thank you, Dr. Pearson, for your dedicated service to Johnston County, especially during this COVID pandemic. So now I present to you Dr. Marilyn R. Pearson.
Good evening, and thank you to the Johnston County Heritage Center and the Black History Committee for inviting me to speak with you today. We are here to celebrate the past, present, and future of Black history. The many health professionals that we are recognizing today made sacrifices to heal and care for our communities, and the diversity of honorees shows the breadth and the depth of the contributions made to the health and wellness of the people of Johnston County, North Carolina, and beyond. Today, I want to share a few words with you about standing in the gap. As a public health director and family physician, this year's Black History theme, Black Health and Wellness, could not be timelier. The impact of the COVID-19 pandemic on our community has been amplified, in part due to the racial and social inequalities of our past. Those inequalities showed up in jobs and living situations that put some at increased risk for contracting COVID-19. But COVID-19 is not just a communicable disease crisis. It is a multifaceted crisis, affecting access and availability of care for the very conditions that lead to illness and death. In Johnston County, many of our community are affected by chronic conditions, including high blood pressure, heart disease, diabetes, and cancer. African Americans are 16% of the population, and the most recent data shows the infant mortality rate for African Americans is more than 2 times that of whites, as is the rate of deaths due to diabetes. The pandemic did not create this divide, it magnified it. These health disparities exist not because they have to, but because we have not allocated enough of our resources to eliminate them. So how do you define health? Is it the absence of disease, the ability to work each day, to cook a meal for your family, or to play outside with your children? The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. It is affected not only by what happens in the doctor's office, but also by where we live, work, play, pray, and play. Most of us would agree that our health is our wealth. Therefore, we must consider it in every decision we make and realize that every decision our leaders make influences our health. And what about wellness? Each of us has our own definition of what it means to be well. It could be the ability to provide self-care or to care for a loved one. It could be the ability to walk daily to the mailbox, to buy groceries, to run a 5K, or it could be the balance of mind, body, and spirit. The way we get to wellness is through the opportunities provided to us to be well. These opportunities include housing, jobs, education, and our places of worship, all social determinants that define our health. Our ancestors knew that these factors were all important for our holistic health and made sacrifices that opened up some of these opportunities for us so that we could be here today. I am a graduate of Scotts Branch High School in Somerton, South Carolina, in Clarendon County. The Briggs versus Elliott case originated in our school and was the first of the 5 cases combined into Brown versus Board of Education. Each year, Mr. Briggs came to our school to remind us that we stood on the shoulders of others, of the importance of obtaining a good education, and the examples we should set for others coming from historic Clarendon School District number 1. Our adage was, it's not where you come from, but where you are going that matters. Just as Mr. Briggs and the parents of Clarendon County fought for a school bus and equal education for their children, so did many others who built hospitals, medical and nursing schools, and health centers to care for their own. From Dr. Furlong starting in 1916 here in Johnston County, to all of the many health professionals here today, we all bring our lived experiences, our different cultural perspectives, and varied approaches to getting our patients to ideal health. For all of us to achieve our maximal health and eliminate health differences, we all have to stand in the gap and serve as the bridge to empower others to reach their optimal well-being. When one of my patients who was diagnosed with diabetes and heart disease heard about a program that encouraged those with lived experiences to undergo training and act as lay leaders, she jumped at the chance. She wanted to give back and knew that her voice would be much more impactful than mine. She provided support and trainings for churches and empowered people to make life changes, just as she had during her journey with diabetes. Cynthia Tootle, a health educator and certified nursing assistant, served our community in many areas, providing education and screenings in our churches, at community events, teaching classes at our hospital, and advocating for those not able to advocate for themselves. She exemplified our public health pledge to safeguard health through prevention, protection, and education efforts. Just as they stood in the gap to promote health and well-being in the community, we have to stand in the gap and be the bridge that connects people to opportunities for optimal health. So how can we all work together to move us toward this goal? We can use our influence, our platform, to be the catalyst for change that we seek. We can stand in the gap. Stand in the gap to serve as the bridge between understanding health and taking action to improve health. Stand in the gap to serve as the bridge to expose our youth to health and all professions, to increase future representation in the workforce. Stand in the gap to serve as the bridge to inclusion in our workplace, our school, our churches, and our homes. Stand in the gap to serve as the bridge to bring awareness around the impact of intolerance and its consequences. Each of us can stand in the gap with the smallest act, mentoring a young person, talking with our community leaders about our experiences, advocating for inclusion in decision-making, or being there for someone through a difficult time. If we stand in the gap, we can build a stronger bridge that will withstand outside forces and lead to positive results for our collective alliance. As we celebrate Black History Month, let us reflect on the past, prepare for the future, and remember that Black history is American history, and that history gives context to the present. We are all making history every day, and we still have work to do on this journey. I ask that you all start your journey today. Write your own Black history by standing in the gap and building bridges so that we and our children can all have the opportunity to reach our full health potential. Thank you again for the opportunity to share a few minutes with you to celebrate Black History Month and our many pioneers of health.
It's my extreme pleasure to give special recognition to one of the African American medical pioneers in Johnston County. Lucille Marion Rayford Jones, a native of Smithfield, North Carolina, is the youngest child of Sylvester Jack Rayford and Lillian Sanders Rayford. She is the youngest sibling of the late Theodore Roosevelt Rayford, the late Roberta Ernestine Rayford Williams, and her surviving sister, Beatrice Ermidale Rayford Jackson. Later in life, Lucille met and married the late The Arthur Jones. They were blessed with two devoted daughters, Yvette Jones Dixon and husband Jeffrey, and Crystal Jones Jackson and her husband Antonia. Lucille was educated in the Johnston County Public Schools. She graduated in 1945 from what was then called the Johnston County Training School. Lucille excelled academically, graduating as salutatorian of her class. Some of her fondest memories while growing up in Smithfield were helping at her father's store, having fun with her childhood friends, Pauline Coley Miller and Annette Watson Lee. Lucille would leave her sisters in the house doing their chores while she was out riding her bike. Her dream in life was to become an interior designer, but her mother said, "No, you won't make any money." Her next desire was to attend a program where she would go to nursing school and graduate as an officer in the Army. Once again, her mother said no, because she'd be around too many men. She chose the field of nursing because as a child, her mother was the caregiver of her grandmother, Lula Creech Sanders, and other family members, and she would lend a helping hand. During the summer, she would visit Clayton to help take care of her Aunt Lucretia. She was mostly influenced by her cousin, Evelyn Bay Atkinson, who was already enrolled as a nursing student. She joined her cousin in Wilmington and enrolled in the nursing program at the Community Hospital of Wilmington. She graduated from nursing school in 1952. After leaving Wilmington, she was awarded 2 certificates recognizing her for meritorious volunteer service at 2 veteran hospitals. Her first nursing job in Kinston lasted about a month. Dr. C.W. Furlong, a well-known doctor in Smithfield, heard she had graduated from nursing school. He stopped by the house and told her mother to contact him when she came home. He knew that Johnston Memorial was hiring Negro nurses. She accepted a position at Johnston Memorial and remained there for 2 years. Influenced by another cousin, Altia Izagari, she moved north to New York, where there were better jobs, with better pay, and more opportunities for advancement, in contrast to the Jim Crow South. In 1954, she accepted the position of charge nurse at a hospital in Brooklyn, New York. Every day on her way to work, she would pass Mount Sinai Hospital, which is one of the world's largest hospitals, wishing to get a position there, and later that dream came true. She had the opportunity to work as senior clinical nurse in charge of the recovery room nursing staff. She also trained and supervised new nurses. She retired from Mount Sinai in 1994, ending 38 years of a very successful and fulfilling career. Her fondest memories as a nurse were seeing patients released from hospital care and hearing thank yous from them and their families. Also, she recounts memories that last a lifetime from friendships developed with staff members from diverse communities. She also traveled to various conferences which were held in cities around the world. Her advice to young people wanting to follow a career in the health profession is first, you have to have a passion for helping others. She suggests you visit and volunteer at a healthcare facility to see if this work is for you. Learn to manage your time wisely. Be flexible because your schedule is not always 9 to 5. And finally, she says, read, read, read. Stay up to date on all the latest information and techniques in the profession. Don't be afraid to ask for help, make a mistake, or admit you're wrong. Most of all, she says, be a team player. Lucille joined the Bronx Christian Fellowship founded by her niece, the Honorable Ambassador Reverend Dr. Suzanne Johnson Cook. She was later asked to join the Mother Board under the direction of her pastors, Reverend Tim English and Reverend Hugh English. She knows God has been good to her, and she thanks Him for her journey. She thanks the Johnston County Heritage Center and the Black History Month Committee for this incredible honor, and prays God blesses us all.